Hello everyone, we'll begin with the second part of associated anemia. In this first one called as anemia of endocrine diseases. In the part 1 we have seen anemia of chronic disorders, anemia of renal disease and anemia of liver disease. So here it is anemia of endocrine disease. This is the third one under associated anemia. So anemia due to endocrine disorders are of different types. There is a list of endocrine disorders called as hypothyroidism, that means thyroid hormones are secreted in less quantity. Adrenocortical hormone deficiency, that means there is decreased production of ACTH hormone, where this is also being produced by the pituitary gland. And pituitary deficiencies, that means pituitary gland is giving rise to other types of hormones, where those hormones are also, it will give rise to stimulating factors, where these have its role over other glands, where they are able to give out its respective hormones. So if the pituitary gland is not working fine, it is also leading to the deficiency of either the hormones or the stimulating factors. The fourth type of endocrine disorder is decreased testosterone secretion. So it is one of the androgen or the male sex hormone, where it is being released by the testes. Leydig cells. The Leydig cells of the testes will release this testosterone hormone. This condition also will result in anemia. Hyperparathyroidism, this is one condition, one type of endocrine disorder where there is increased parathyroid hormone secretion, where all these endocrine disorders will result in anemia. So hypothyroidism, in this the blood picture will be like mild to moderate anemia will be seen, as well as normochromic and normocytic anemia. So there will be normal red cell survival. The cause for this the cause for development of anemia in case of hypothyroidism is there will be decreased erythropoietin secretion, therefore there will be decreased marrow production, where it is leading to the anemia form. Second endocrine disorder, that is adrenal cortical hormone deficiency. In this will make out mild normochromic and normocytic anemia. The cause for this type of anemia in the ACTH hormone deficiency is unclear, but upon giving this ACTH hormone in the treatment, the anemia can be corrected. Third endocrine disorder, that is pituitary deficiency, where pituitary gland is not able to give out its secretions, the hormones or the stimulating factors. So this results in greater depression of hemoglobin concentration, that is nothing but anemia itself. So the cause for anemia in this pituitary deficiency is there will be effect of multiple endocrine glands. So as I said, pituitary gland is having its control over other glands also. So when the pituitary gland itself is not working fine, the other glands may not receive the stimulating factors from the pituitary gland, so that the other endocrine glands won't be able to give out its secretion. Therefore it also results in anemia. Most probably there will be loss of the growth hormone. Next one, decreased testosterone secretion, where this is also a hormone secreted by the testes. So here there will be mild anemia is seen and results in decreased red cell production in the men. Mainly in the men this anemia will occur. The cause for anemia is there will be decreased red cell production, where this androgen, that is this testosterone, will have its effect over the erythropoietin secretion. So when the androgen, that is the testosterone secretion, is less, the erythropoietin secretion is also affected, where this erythropoietin secretion won't be sufficiently present, therefore it results in anemia. The last one called as hyperparathyroidism, that means there will be increased secretion of parathyroid hormone from the parathyroid gland. So here there will be normocytic normochromic anemia itself. Cause for this type of anemia is Parathyroid hormone suppresses normal erythropoiesis. It is said when there is increased secretion of parathyroid hormone, the calcium level increases in the blood. Therefore, the kidney will receive this calcium and renal calcification will result. So when kidney gets deposited with the calcium, the kidney is not able to release enough concentration of erythropoietin. So there will be decreased erythropoietin, and also the bone marrow gets filled up with the fibrous tissue. Therefore, it is going to hamper the erythropoietic activity, so that there won't be enough production of the red cells. So these are the 5 endocrine disorders which will result in anemia. Next type of associated anemia, that is associated anemia or anemia associated with bone marrow infiltration. It's also known as myelopathic anemia. So in this state, bone marrow will be replaced or it will be infiltrated by certain other cells. So there is a list of conditions where in these conditions these cells gets replaced in the bone marrow, or we can say bone marrow is getting infiltrated with other forms of the cells instead of the blood cells. That is some conditions like metastatic carcinoma. That means it is a cancerous state where the cancerous cell will move from its primary region to the other regions. Multiple myeloma, it is a cancer of plasma cells. Leukemia, it is the cancer of the WBCs. Lymphoma, it is the cancer of the lymph nodes. Lipidosis or storage disease, it's a genetic disorder where there will be accumulation of the lipid content in the body due to the deficiency of certain enzymes. So these conditions will suppress the normal hematopoietic activity. So those conditions itself are listed out here. Diseases causing myelopathic anemia, malignant diseases, that is cancerous states, hematological diseases like acute and chronic leukemias, that is AML, ALL, as well as CML, CLL, myeloproliferative disorders, that is all the myeloid series of the cells will show increased production. So there are different types of myeloproliferative disorders. One among them is CML also. Multiple myeloma, it's a cancer of the plasma cells. Non-hematological diseases like carcinoma of the lung, breast, prostate, stomach, etc. That means the cancer of the different tissues. Lipid storage disease, where this is a genetic disorder where there will be increased accumulation of the lipid content in the body. Some examples like Gaucher's disease and Niemann-Pick disease. Disseminated infectious disease like miliary tuberculosis, it's a tuberculosis itself where upon radiological examination of the lungs will show the presence of tubercle bacilli in the form of small spots, where those small spots appears like that the size of the millet seed. Therefore it is termed as miliary tuberculosis. It is one of the disseminated infection. Laboratory findings, blood picture shows normoblast plus immature neutrophils. This is one of the important feature with respect to this myelopathic anemia. So the presence of normoblast as well as immature neutrophils indicates a particular reaction called as leukoerythroblastotic reaction, or it is also termed as leukoerythroblastic anemia or leukoerythroblastosis. So very important, in either of the form this particular state can be called blastotic, blastic anemia, blastosis. So immature neutrophils may be the metamyelocytes, myelocytes, promyelocytes as well as myeloblasts. The precursors of the neutrophils are also said as the mature or the young forms of the neutrophils. RBCs will show normocytic normochromic anemia. Along with this, another characteristic feature is the presence of this teardrop cell. So the blood picture shows normoblast plus immature neutrophils, that is leukoerythroblastosis. Along with this, RBCs also shows teardrop cell in its features. This is the teardrop cell. A pointed projection will be present which appears like a drop. WBCs, that is total leukocyte count, will show normal low or raised. All the three things can be present. Platelet will show normal or reduced, and the blood picture with the presence of nucleated RBCs, that is the normoblast, and shift to left, that is the neutrophils immature forms. That is, if the neutrophil itself is present, where it is going to show its lobes less than 3, this particular form is known as shift to left, and this particular reaction is known as leukoerythroblastic reaction. Nucleated RBCs, normoblast, as well as neutrophils with less than 3 lobes or any other immature forms of the neutrophils, if they are present, this particular state is known as leukoerythroblastic reaction. Bone marrow examination also can be done, so that it is going to reveal the condition that which is responsible for the reaction. Thank you.